Um, I just wanted to kind of go over some of the information regarding the personal protective equipment and kind of why we're changing and kind of some of the thoughts behind it. So most of this is going to be taken from the CDC's website. One of the big questions I think that is really important for us to ask, and this is something that we really don't know, but there are models out there where we kind of predict as to how long it's going to be based on hospitalization. So this is just a little bit off from where we're at. So this is the website. If anybody is interested, this is a Google slide, and I can give you a link to it, and you can access all of the references that I put in here. Okay, and this site is the one that the state recommended that we use to give to the hospitals for predicting when this is going to be and how bad it's going to be and those types of things. Having said that, here, I'll go to the next one. This is, I put for a population of 10,000. I think that's probably a decent representation for Glenn Medical as to our service area. And I put down that we had about 60% of the market share. We may have a little bit more, it might be, I don't know, we'll see. I don't know about those things. And these numbers make up a big difference. The other one that really makes up a big difference is that it allows you to go ahead and to change how much social isolation you guys is being done in the community, and it makes a huge difference for the curve. It makes a huge difference. You know, I'm going to take this off. I'm not close to anybody. So this is what the graph looks like. Okay. So the thing that I think is interesting. So number one is this is kind of probably we're a week or two behind because we actually haven't had a hospitalized patient here yet. We had one in the county that was admitted over to Enloe. But we haven't had our first hospitalization here yet. But this is counting if we were to have our first hospitalization today. It isn't until we get to about May 30th as to when this starts getting bad here. Okay, that's when it hits its max. It's predicting that we'll probably have about 11 patients. And we'll end up with about 5 patients that are going to be needing ICU level of care. And that we will have 4 patients that are intubated at one time at its worst. And we'll probably start looking at our first intubated patient not long after it starts coming, okay? So that kind of gives an idea as to how severe this could be. I will tell you once again that this is a guess. If the nursing home, it goes through the nursing home here in town, we could end up with a whole bunch. It stays out of the nursing home, maybe we don't end up with very many. So this is just kind of a ballpark kind of idea. But the thing I want to point out is that this goes past August. So this is August 16th here. So this is going to be going on until the fall, that this is going to be here. Okay? This is the link to the current CDC's recommendations for optimizing the use of face masks. And what they're talking about when they use face masks is they talk about N95s and they talk about the surgical masks. And they use those interchangeably for most of the recommendations, but they'll say, hey, the evidence is clear that the N95 does a much better job than the surgical mask. Okay? So this is kind of what it talks about, how do we make our supplies last? Because the reality is that we have a finite amount of resources and we probably are not going to get any more. We've gotten our cash from the federal government, and we probably aren't going to get any more. So we really need to make sure that we keep our gear. Well, we can't be throwing it away, using it once and throwing it away. This is not business as usual. This is not business as usual. Interestingly, I don't know, anybody here work at Rideout? No, okay. So Rideout, what they did is they didn't give them any of their gear from the stockpile, the county didn't, until they had their first COVID patient. And so they already knew what it felt like to be using garbage bags and to not have gear, and I think in some ways that was kind of wise because everybody realized, hey, this is what it feels like going in and taking care of people who could have COVID and not have any gear, and it made it so everybody was taking it serious. Because reality, we are at the very tip of this. We're at the very tip of this, And you know, the information that I'm getting from the county is that don't plan on getting anything more. I will say this, that we have been lucky. We've gotten a couple of boxes, you know, like 20 a week of N95 masks. But if we're going through and everybody using them, we're gonna run through that really quick, and we've got to get this to last. Okay? Does that make sense? Okay. So this is kind of what some of the things. So reducing the number of patients seen. I don't know if you guys know this, but we went in a week's time from doing no telehealth to at the end of the week seeing 70% of the patients as telehealth from the clinic's perspective. Now we are virtually doing everything that can be with telehealth. We're doing, and we're only having about 10% of our patients ever coming in, stepping foot into the hospital. So we've really done a lot from the clinic perspective to decrease the amount of utilization of things. And to be honest, I think it's safest for everybody. I think it's safest for everybody. If we can keep people out, we can keep people out of waiting rooms. And when we do have people in waiting rooms, I'll just throw this out, one of the other things that we're doing is that we're having them wait in their car until the room is open for them to be seen, and then we're calling them and asking them to come in. So we're keeping our waiting rooms completely empty. So reduce the number of patients seen, okay? The only essential healthcare providers in patient care areas. So we really want to, especially here, we want to protect it. Anybody who doesn't need to be here just needs to not be here. Whether that's family, whether that's, obviously there's some things for maintenance that we need them. We're going to be doing a bunch of stuff working over, transitioning our old ICU back into essentially an ICU unit. And so we're going to be having a lot of maintenance, but we want to keep that as to a bare minimum as much as we can. Reduce face-to-face healthcare providers, and when in this case, the healthcare provider is anybody who's taking care of a patient, which I think is a fair definition. Encounters with patients. And so one of the things that we've talked about doing is we're going to be having little tablets that we give the patients, and then maybe some of the things that you guys do as nurses that can be done as via kind of like almost like a telehealth situation where we're able to communicate. Some of the patients that's not going to be feasible, but some of them that will. And it really will become important when we start having patients with COVID. Is we want to limit the amount of exposure absolutely as much as we can. And we have plans for doing that. We've actually got somebody who's going to be helping us out with doing that. We're going to exclude visitors, cohorting patients. So as much as we can, so we're going to probably try and put all of our patients down in that old ICU area. We're going to have just one nurse back there trying to take care of them as much as we can. We're going to have keep out the phlebotomists as much as we can. We want to isolate as absolutely much as we can, and that isn't just good safety for everybody, but it also helps protect the care, right? So we want to limit our exposure as much as we can, and then I already mentioned the telehealth situation. So contingency strategies. So one of the things that they're recommending is that we remove the face masks from the patient areas. So the patients, if we're seeing a bunch of patients in the ER, we need to get them out of there because they're going to chew through our supplies. We've got to protect our supplies. Absolutely, and I'll have a slide that kind of talks about this, but absolutely clearly the most important resource that we have is you guys. There's just absolutely no question about that. You guys are our most important resource, and we want to protect you guys. Okay? Implement extended use of face masks. So, when business as usual, we take off our face mask after taking care of one patient, we throw it in the garbage, and we don't worry about it. What we're going to be doing here is very different than that. This is not business as usual. When you're done, we're encouraging to use it as long as you can. If you're going to take it off for lunch or something like that, put it in a paper bag, write your name on it, date it, and the reason why we're doing that. So there's a lot of hospitals that what they're doing is they're saying just make it last the whole shift. Here's the thing: it is probably not as big of a deal right now, but it's going to become exceptionally important, and we need to develop these good habits. The outside of the mask is contaminated. Just plan on it. Okay, you're breathing in those particles. They're sticking to the outside of the mask. They're not making it into your lungs, which is good. But that outside of the mask is contagious. It's as contagious as anything else. Okay, you put it in a mask, you put it in a paper bag. You go to grab it out. You slide it out. You got your hand touching it. I mean, you could really infect yourself pretty easily. And so what we've decided to do, we thought the best thing to do would be to go ahead and to write down your name and the date, put that as the, and then put it in another place, set it aside. We know that the COVID-19, or the coronavirus, that it lives for a 2 to 3 days on its most contagious surface. And the most contagious surface can be, the longest lasting that it has is plastic and stainless steel, and that's 2 to 3 days. Now, I'll tell you that it wasn't, and I was using this information because there was an article in one of the the magazines about this, about 17 days on one of the cruise ships that they were able to isolate that off. That is false. That is false. That was a false thing that got published, and unfortunately, I've been spreading that rumor because I thought it was real, but that's not true. So 2 to 3 days. If we set it aside for 4 days, it should be done. You should be without having it being contagious anymore. Does that make sense? Yes.
So we're setting them aside. We're not setting them in a paper bag and setting them aside.
So we're going to set them in a paper bag. I think that's probably the easiest way of keeping it. And then where are we going to be putting these paper bags?
Well, you can stick them back there on the counters.
Okay. It's going to multiply pretty quick. The other thing you could do is you could put a 1, a 2, and a 3, and a 4, and then when you're done with 4, you go back to 1, and you can rotate it through it. Reality is we're probably going to, we don't really have very many people who are going to, right now anyways, working more than 4 shifts in a row. That may change. So really we're talking about a longer period than that, really, from when you use it, okay? Any other questions about that? Does that sound like that's a reasonable thing to do?
I have a quick question. So I'm not going to be back for about a week after today. So I can reuse.
Yep, reuse it in a week. Right.
Put your name on your paper bag and your date, and when you come back, you use that name one.
Where do you get the paper bag?
They were sitting on the counter right there.
And if they run out, let me know, because I have a huge stack of them.
Okay. So inside the nurse's break room, we have paper bags. If they're out, go and talk to Debbie. Okay. We need to discard them. So when we're gonna get rid of them is if they're soiled, they're damaged, or they get to the point where they're hard to breathe through. Okay. So that's gonna be our plan. Patients to use tissue or other barrier cover over mouth and nose. Okay. So reality too is that if we can have something over somebody's face to catch their coughing, their saliva, their nasal secretions, we want to do that. And I think that the homemade masks are ideal for that. And if we can put one on somebody and they're able to breathe okay with it and they're okay with it, even if they take it off when we're not in the room, we can ask them to put it back on. That will decrease the spread by a lot. It really does, okay? And I'll share why we're kind of transitioning over in a few to what we're doing now. So crisis capacity strategies, use face masks beyond the manufactured design shelf life, implement limited reuse face masks, and outside of masks must be considered as infectious. And the outside of the mask really needs to be considered as infectious. If you're touching it, you got to wash your hands. You got to use some hand sanitizer. Okay? You touch your mask on the outside, you got to clean your hands. And that's infectious. If you've got to adjust it, grab it by the straps. That's safe to do. You can do those things, but touching the mask itself, you can't do, unless you wash your hands. So that's just some ideas of different things that can be done for cleaning them. If somebody really has a lot of concerns about the 4-day thing, it can be put into an oven at 170 degrees for 30 minutes, and that will kill the virus also.
was my
The
question.
concern is how long is it going to last, the rubber and those types of things. So that's some things. There's a whole bunch of information on that website. It's put out by Stanford. I think it's probably a pretty good resource. Go ahead.
That heating. My question is, we are coming through the spring. We are gonna have sunny days, so laying like masks under sunny side, like during.
The UV light. So yeah, there is some evidence that 30 minutes of UV light exposure will kill the virus. And so they actually, in that article from Stanford, they talk about that as being one of the methods of doing it. Here's my only concern with it. And so we are getting a box that does UV. So you put something in it, you close it, and it zaps everything. My concern with sitting it out in the sun is what if there's a shadow? That's my only concern. The box eliminates that problem. And we have that ordered. We're waiting for it to get here.
I wasn't thinking about like professional way sterilizing
Yeah,
it, but
sunlight.
personally, like till we get something proper, can we use that? Because
Sunlight,
hmm
yeah, but you'd have to have a constant, consistent heat on it.
Mhm.
Right. I think that I really, so, and we can talk about it if people have a big concern about waiting 4 days. But I think that that's a very reasonable approach. It doesn't damage the face mask in any way, shape, or form, and it can be used multiple times. So that would be my first go-to. If somebody really is concerned about it, we can look at some other things. Like I said, we have ordered a UV box that will zap it from all directions, and we'll put those in there. And when that becomes available, we'll probably start implementing that.
that's great.
Okay. Go ahead.
So when you said that we're gonna take them off and put them in a bag, so say we're gonna eat lunch, what do you want us to do?
Right. So I would say go ahead and put it in a bag. We'll get you another one.
So do we
Okay.
need to go find somebody at lunchtime, or are they available for us to just grab a separate one, or what do we do?
I've got some in my office I've been handing out to everyone, but I didn't know whether or not.
So in this, we're implementing this new, and I'll show you why we're implementing this now in another slide or two. But so this is new. We're figuring out the process, but probably at the beginning of the shift, everybody should get two: one for before lunch and one for after lunch or after the meal, because we really want to protect you guys. We really want to protect you guys. We don't want you setting it down and then infecting yourself.
But like if we wanna just take a drink in between, right now we can just loosen it and take a drink and not.
I think you just got to be really careful.
Right.
I think you got to be really careful. You need to consider the outside of that mask as being infected, and that being just like something that somebody had just coughed on.
Right.
And when you squunch that down and then you pull it up over your face, I would just be I'd be very cautious with that. I'd be very cautious with that. Okay? So this is the web, this is the what's that?
I said I gotta drink water, so.
I was thinking, is there a way that we can engineer those things to do just this behind our ears with these masks? The ones like she has one on, and like if we had some way, can we engineer it where we can staple it to where it could be something we could do this instead of over the head?
Well, that'd
Would
be
that
awesome.
would that take
Yeah, I
away
don't know about
from
the N95. Reality is this is the state's status of where we're at as a county. Okay, so this has got to be used from the ambulance to the fire to the nursing home to the hospital to all the clinics when people are running out. Is we have a fair amount of N95s. We've got 10,000 of them, but that will go through much quicker than what you would think. We have 280 of the regular face masks. That's it. That's it. So, and I know that it's nice to keep your mouth wet. Physiologically, if you're wanting to take that risk, but a good drink of water before, and I would keep it a minimum. This is the current recommendations from the CDC regarding exposure, healthcare provider exposure. The take home is this, is if we have a healthcare provider, meaning any nurses or CNAs, and they get exposed to a COVID patient, and what their definition of exposure, a high-risk exposure, is less than 6 feet away and more than a few minutes. So I don't know what that is. That 2-3 minutes? I don't know. That's as specific as they get. A few minutes. Then that person, if they're not wearing some kind of eye protection and a mask, is on quarantine for 14 days, unable to work. That's the new CDC's recommendation.
And glasses
don't
and
have-
eye protection, you can still get around.
Yeah, probably that provides at least some. Now, if the person happens to have a mask on them, you got to have the mask, but you don't need the eye protection. If the infectious person has a mask on them, and I really think that the cloth masks are where those are going to come in right now. But that's
Everything I did with goggle glasses.
what's that?
Talking to her.
Yeah, the goggle glasses, and
The
so we're
goggle
gonna
glasses.
be getting some goggle glasses.
I mean, because we can disinfect them,
We
right?
can disinfect them. We can disinfect them. Okay? Questions about that?
It's not easy when you have glasses on to use mask and plus shielded mask. It's gonna be difficult for us, but we're gonna manage. We're gonna engineer, as she said.
You know, we're gonna, so the good news with this is we probably have a little bit of time. Now, how much time that is, we don't know. We've only got 2 cases in the county, and only one of them are community spread. Having said that, I mean, just looking at the data and knowing
One
that
is
about
3 is
about 15% of require hospitalization, then that probably means we have 6 or 7 at least out there in the community that we don't know anything about.
Is it a bit of a violation to know who the person is, kind of like a name, or?
Yes, it is. Yes, it is.
It is.
So so Andy Miller, when he talked about the first case of COVID, he said, I'll say that they're from Chico because that's a large enough area that it doesn't give away who they are.
Okay. What if that COVID patient is not complying with the quarantine?
Well, here's the reality is that if we believe the data from let's see what it was called the Royal Princess cruise line, 17.9% of the people who were spreading the virus had absolutely 100% no symptoms. So we really are best to pretend like everybody is infectious. Social distancing really works. I mean, I probably should have thrown on, and maybe I will add it. There's